So hip internal rotation is a big range of motion that we find that most patients need to work on. You can get into this position and use this as both an assessment and treatment. So if you get into a 90-90 position and you grab your back ankle and you lift your foot up, this is considered passive range of motion, passive internal rotation, okay, because I'm lifting my foot. When I try to do that actively now, so I'm going to try to lift my foot up, there's not a lot happening. My range between passive and active was very different. If that's you, then what we'll start is where I can actively lift. So that's about as high as a foam roller. So I'm going to put my back leg on a foam roller, okay? If you can't lift your foot at all off the floor, just get rid of the foam roller and start wherever your active range is, which might be on the floor. So from this position, you're going to push down with your foot into the foam roller. So I'm pushing down for 10 seconds into the roller. You should feel tension right on the outside of the hip. After 10 seconds, I'm going to try to lift my foot off the roller. This can be an isometric contraction. My foot's not moving. I'm attempting to get it to move. So a 10-second lift off. 10-second push, 10-second lift off, and you can repeat that about 3 to 5 times. So if you get into this 90-90 position and you physically cannot lift up your leg, okay, you would have a limitation in passive range of motion. That means what we want to do is start to work into the capsule. So this is going to be our time under tension hold. We're looking for about 2 minutes here. So I'll take my thumb and I'm going to put it into the crease of my knee. I'm going to traction towards the camera, towards you, with my thumb, and then I'm going to drop my left hip backwards. So my hip is coming back this way, and you'll feel a tension through the capsule. So again, it's a traction. My vector is going that way, and I'm going to drop my hip down to the floor, and this is where you hold for 2 minutes.